Lupus.
It's never lupus. It's not lupus.
It's lupus.
Treat him for lupus.
It's lupus.
There's no need to get snippy. I don't think this is lupus.
Lupus.
Lupus could cause...
It was prednisone for lupus.
Or maybe lupus. Lupus could cause lung scarring and a rash. It's lupus-induced kidney failure for lupus nephritis. It's lupus.
Lupus. Lupus.
Lupus. Lupus. Lupus. Lupus.
Lupus.
It's not lupus. Lupus is a bad diagnosis. It's not lupus.
So why is House's lupus joke funny? It's because lupus is known as one of the great imitators, which means it is often mistaken for other diseases. Because lupus has a variety of symptoms that come and go, meaning it's not always there, it can be easily mistaken for other diseases. Also, because common initial symptoms of lupus are very similar to other diseases, like fever, joint pain, and fatigue, often people don't think of lupus even though it could be lupus.
So what exactly is lupus? Lupus is an autoimmune disease, which basically means that it results in an overactive immune system. It can affect any part of the body, and it comes and goes, which is categorized by flares and remissions. Typical of lupus is the malar rash, aka the butterfly rash, which, as you can see, develops around the cheeks and the nose of a person's face. There are four most common types of lupus. The first one is the systemic lupus, also known as SLE, which we'll be talking about a little bit later. And this is the most common. It affects the entire body, so the heart, the joints, the lungs, skin, liver, you name it. There's also discoid lupus, which is more localized to the skin, and even more specifically to the face and even like the top of the scalp. And you get sores and scars, and it's usually generally presents in children more than any other age group. There's also drug-induced lupus, which is basically if you overuse certain drugs such as anti-inflammatories or like drugs that prevent heart disease, you could actually develop lupus as one of the side effects, which is ironic because lupus actually causes inflammation, so overusing these drugs will actually produce the opposite effect. And this will, like I said, it'll recede after discontinued use. There's also neonatal lupus, which is basically SLE symptoms with discoid rash. So usually you inherit it from the mother when you're an infant, and it'll affect any part of the body, but you'll also have rashes on your face and sores and scars and that kind of thing. So here are some pictures of systemic lupus, and as you can see here, this person has the characteristic malar rash, typical of someone with lupus, and also you can see some rashes and other nasty looking things on their hands as well. And here we have discoid lupus, which, as stated earlier, is typically associated with rashes on the head and the face. And here we have neonatal lupus, which is lupus of the infant, and you can see the typical malar rash present on his face as well as his head. And drug-induced lupus is basically the same as SLE in terms of what it looks like, so there aren't any unique symptoms to it. SLE, or systemic lupus erythematosus, is the most common serious form, as I stated earlier. Is 9 times actually more common in women than in men, which I'll talk about why a little bit later. Also, you usually will find this more in the age range of 15 to 35, and usually they're also non-European. And there really is no cure for lupus, but it is highly treatable. Usually you're treated with immunosuppressants such as corticosteroids, also known as prednisone. Most of you might have heard of that. And what it does is it controls the inflammation that results from lupus by mimicking cortisol, which is produced naturally in your body. And you can take this either through an IV or orally. Symptoms of SLE. According to the American College of Rheumatology, you need to have a wide array of symptoms in order to actually be diagnosed with lupus instead of just one. And some of these include like rashes, photosensitivity, arthritis, kidney disorder, which we'll talk about a little bit later. And common symptoms can lead to a wrong diagnosis. Like, you can't just diagnose someone with lupus based off of a rash that they have or a fever, because this can be common of like the flu or just a cold, which is why they developed this chart in order to narrow it down to lupus. And more specifically, you actually need 4 out of these 11 to actually be considered positive for SLE. So right here we have a diagram of all the body parts that lupus affects.
And this is an interactive diagram of what you guys just saw. So you can see how the circulatory system is highlighted. So you can see there are blood disorders in lupus. There are like kidney problems, retinal problems, gastrointestinal problems, heart and lung problems. Basically, any problem can be associated with lupus, as shown by this diagram. Like, all the parts of the body are basically highlighted. Some environmental triggers can actually, as scientists speculate, trigger lupus. These include some of the bacteria and viruses, also UV rays, which can cause photosensitivity, which is actually one of the symptoms of lupus. Smoking has also been speculated to cause lupus. And as I said before, like viruses such as the Epstein-Barr virus, which also is linked to mono, and both of them have also been speculated to trigger lupus in the body. Also, Lyme disease, which was covered a little bit earlier in class, is also speculated to trigger lupus. And we should make a distinction that these are all speculations, and there are actually no known causes of lupus, especially from the environment.